All right, thank you for that. Well, there is a push in the Virginia General Assembly to implement eating disorder screenings at school. Delegate John O'Bannon of Henrico is among legislators supporting a program to help identify students who are suffering from the condition and those who may be at risk. The National Eating Disorder Association says Virginia is the first state across the country considering this step to improve and save lives.
With as few as 5 simple questions, you can identify children who may be symptomatic of eating disorders and address those issues early so that you don't have to address them in a hospital later.
Now, Michele Chesser is here from the Virginia Joint Commission on Healthcare. You did a study about this. Tell us a little bit about it.
Correct. We were asked by Senator Linda Puller to look at the problem of eating disorders in Virginia, and I looked at the different types of eating disorders that exist, their causes, their prevalence rates, the challenges that are involved in treating eating disorders, and there are a number of them, as well as prevention and awareness issues. And the policy options that we submitted as a result of that study, a number of them that were adopted had to do with dealing with issues of prevention and awareness.
And screening is sort of one of those recommendations
Absolutely.
That you found that could be something beneficial to the children here in the Commonwealth.
Yes, they've looked already at different types of screening that are implemented. Of course, I think we all know of the scoliosis screening test that we did, but there's also suicide screening tests that have been researched quite thoroughly, and they're looking to kind of follow along those lines to try to address this problem in the beginning stages before it's too late. The death rate for individuals with anorexia that go untreated is 20%. So this is and it is in fact the mental illness with the highest mortality rate of all mental illnesses. That includes depression, schizophrenia, all of them. This is the highest mortality rate. So it's something that I think is important to look at and try to catch before it gets to that stage.
Absolutely, and I talked with the National Eating Disorder Association this morning, and one of the things that they are stressing now is you got to sort of break the stereotype. This is an issue that can go and affect every gender, every race. This goes across the line, and they do believe that the education system would be a great way to reach out to people of all different demographics.
That is true. I mean, that is the one arena in which you have access to all different types of children, and you have teachers, school nurses that are with them for hours and know them, very well. And the idea would be, for one of our policy options that was approved, is to ask the Department of Education to request that these schools help by providing information and instruction for the homeroom teachers and the school nurses, instruction that is improved by either the AMA or NEDA, to give them a better idea of how to identify eating disorders and then what to do whenever they suspect that a student might have one, how to help them get the care that they need.
Well, Michele, we thank you for coming in and sharing some information, and we look forward to seeing where this goes in the General Assembly.
Thank you very much.
Christina, let's head over to you.